Hi, my name is LaQuanda Jefferson. Welcome to Familial Bonds February broadcast on love and intimacy and behavioral and emotional health awareness. So, for those of you who don't know or are, tuning into our very first, tuning into us for the very first time, Familial Bond Psychotherapy and Consultation Services offers a wide array of services to individuals in the realm of behavioral and psychological health, right? So, mental health matters, and I personally, as the owner, work to destigmatize um, the aura of the experience of seeing a psychotherapist or life coach or counseling professional. So, we encompass a network of individuals who are committed to not only your personal well-being and growth, but also to the psychoeducation part, which is very important for all of us to go effectively. Um, this particular month is a month that's inspired by um, love and affect and relationships, right? So um, I just can't wait to delve into this content. It's going to be helpful for all people who suffer with um, intimacy and sexual issues. Okay. So, marriage and family therapists. Okay. So, because I am a marriage and family therapist, I feel like it's important that I sort of outline what that looks like. Because even the life coaches that I employ at my practice, I still think it's really important in our training that they learn to be nonlinear and that they learn to incorporate all elements of a person's situation or their environmental context, the things that are not necessarily directly them, right? Or maybe directly related to them, but systemically connected to them that may be influencing the maintenance of the problem in their life. So we look at things from a systemic lens and not a linear lens. We don't employ a lot of coping strategies and that's it. We actually help you to heal through your issues. And then also in the coaching and planning part, we help to walk alongside you as you um, develop, as you go through the journey of discovery and recovery, elevation, and enlightenment, as you become more self-actualized in that walk. We are there for you, encouraging you and providing you with the resources and the tools that you need to be successful going forward. So how do we conceptualize people, problems, and resolutions? I talked about that a little bit just now. Everything is systemically, you know, conceptualized. Essentially, as a humanist, I personally believe that people are naturally good. People naturally want to be good people. People naturally want to strive. They want to accomplish great things in life and they want to be productive. However, sometimes they're not so productive because there are various elements of the system that may be dysfunctional and symptomatic and cause them to not be able to reach their full propensity in life. Okay. So the purpose and pursuit for me, my purpose in becoming a marriage and family therapist, of course, was to be able to help people. I'm extremely passionate about people, the work that I do, the lives that I've impacted, and the lives that I intend to continue to leave an impact on. The most important thing to me is an individual learning something new. Every single opportunity, every single moment of the day has to be seized in a way that allows us to grow. And we are not growing if we are not spreading education and elevation, if we're not aspiring to empower people, if we are not helping other people and paying it forward, if we're not doing the thing in our lives that make us a functional member of our comprehensive extended system of life. Okay. So delving into the content for this month, we're going to talk about love and relationships. So what is a healthy relationship? People oftentimes ask this question, and essentially our question of the month comes from this area. And I made myself a couple of notes so that I could stay on track. And, you know, the time constraint, I like to keep these videos under 30 minutes, right? So talking about the healthy relationship element, a healthy relationship is a relationship that has the flexibility to deal with the problems when problems arise in that relationship. So it doesn't mean that you are outside of problems. Doesn't mean that you are outside of strife and despair. Because we will have individual context problems, we'll have family related systemic problems, we will have a combination of co-occurring issues in our lives at some point in our lives. But the idea is to be able to maintain that equilibrium, to maintain that steady state of functioning, okay? Being able to function well. So that's pretty much what a healthy relationship is. From a fluid perspective, you're able to correct negative communication cycles, negative behaviors that maintain the problems in your relationship, these types of things. You know, talk to your partner about how you're feeling, what your thoughts are, you know, take into account what their feelings are, be able to sit with their emotions and truly seek to understand who they are as they grow, you know, in life. So love and intimacy. This is one that is really, really important to me. Love is a very high degree of affect for a person, thing, place, thoughts, elements in life. And love motivates a lot of the things that we do in life, or lack thereof. Many people, most people are motivated by emotion, okay? So it's important to have a healthy balance, right, of emotion and wisdom, or pragmatics, or the idea of, you know, assigning logic and reasoning to your decisions before you make them, and not necessarily the emotion alone. So love normally incites or excites intimacy between people. And intimacy doesn't necessarily have to be sex in itself. Intimacy can be closeness, because technically that's what it is. Close and intimate relationships, whether there be professional relationships that two partners are close, you know, to one another because they have a common goal or a common objective in their work, or family members. They're close and intimate because they share the same family lines and values, and they share the common goal and responsibility to the family system. Intimacy is oftentimes broken when trust is broken, and that is how it relates to the content of today. Okay, so that's that piece. Rebuilding trust can sometimes be difficult, but we'll talk about all of the elements of building trust and vulnerabilities and all of these things over the course of this presentation. So sex. Sex is a physical encounter of intercourse between two people, or more than two people. So the idea is, okay, how do we connect love and intimacy and sex in the same sense when we're talking about love and relationships, right? Because essentially, when you are in an intimate partner relationship with someone, you're looking to achieve a higher sense of closeness to that individual, to the constructs, the people in that relationship. They're looking to evolve into something greater. And we'll talk about what that something greater is a little bit later. Moving along. Determining sexual functionality. So the best way to talk about sexual dysfunction is to talk about what function is, right? What makes you functional as a sexual partner? What makes you functional, sexually functional as an individual? So sexual functioning means that you're able to achieve the three areas of sexual excitement and sexual functioning, and you have no issues with being able to achieve them. Okay, so the three areas of sexual functioning for assessment is desire, arousal, and orgasm. So let's talk about the desire piece, right? Just in itself. This is that positive, longing anticipation for sexual pleasure, feeling like not only do you want it, right, but you also feel like you've earned it, like you deserve to be sexually pleasured by your partner, okay, or by the sexual encounter in itself, right? Ooh, excuse me. Okay, so the next area is arousal. And to elaborate on it more, arousal is a state of response to stimuli. Okay, so it's going to talk about your receptivity or your responsiveness to any sexual stimuli that stems from the whole desire part. When a person desires you or you desire sex, essentially there's some touch involved in that, right? And that's kind of where you move to the arousal part, the arousal phases of sex. So then that ever so soft touch or eye gazing and staring into one another's eyes and in one another's space and encompassing and absorbing elements of the other person, you are becoming closer. And essentially what highlights you being able to achieve this stage um, of the three stages of sexual intimacy and function is that for a woman, moisture, right? Or for a man, an erection. These things would be indicative that you've reached the high points of that particular section, right? So moving forward, the final stage of sexual functioning is the orgasmic stage. An orgasm is the final stage that encompasses your being able to be functional sexually. We know that after you have achieved the arousal stage, right, you should engage in some type of a sexual encounter, right? So during that sexual encounter, you're doing that sexual encounter to achieve an orgasm. So that process should be a voluntary response that your body makes and your mind makes and your spirit makes. That's a combination of high arousal and satisfaction. And satisfaction, if we're going to talk about that a little bit more, it's like that feeling of emotional and sexual fulfillment all at one time. It's that explosive feeling of excitement, but at the same time, leveling out, right? Or being very highly, not only just turned on, but fulfilled. So it's that high point and that end point, right, at the same time. So I also highlighted common sexual dysfunctions. Okay, so we'll talk about some of the more common sexual dysfunctions in couples. And before I do that, I kind of want to talk about how dysfunction is evaluated or how we look at sexual dysfunction, kind of like as a whole, right? So sexual dysfunction in itself is a couple's issue. It's not an individual issue, although an individual may be exhibiting particular symptoms that cause for the system to be in therapy or in coaching or before their doctor trying to figure out what's going on, right? Essentially, they're linked, right? And you could have a dysfunction in either of those three areas or a combination of those three areas that we mentioned were indicative of functioning, right? Sexual encounters. So just to kind of look back on my notes, some of the common ones that I wrote down are non-orgasmic response during partner sex. So not having an orgasm, when you're having sex with your intimate partner, not being able to achieve an orgasm. Sorry. Also, hypoactive sexual desire disorder, HSDD, is common. That's when you have a low desire for sex, and that would fall on the spectrum of the first area we talked about, desire, right? So low libido, low T, and those types of things. Okay, low testosterone, also not not getting excited at the idea of yourself and your partner being involved in sex, right? Or yourself being involved in a sex act at all. Painful intercourse is another common one. And these are, I think the ones that I've listed so far are mostly related to women. And some of the males' common sexual dysfunctions are going to be also HSDD, because they can also suffer from hyposexual desire disorder, which is a low desire. We talked about that piece, but also erectile dysfunction, premature ejaculation. These are all common issues that we see couples struggle with. So the idea is to be able to solve the problem that people are having in a way that works for the people who are having the problems. For example, if you have a couple and one person is exhibiting the symptoms of HSDD, then they come in and you do a full and comprehensive assessment. And the thing is, making sure that you have the right fit is essential at that point, because you want to make sure that you can gain all of the insights that we can in order to help you. So you must be 100% open with your practitioner, whether you choose to use a sex therapist, or you choose to use a life coach or sexual consulting partner for sexual issues. This is something that is up to you solely, but we'll talk about how you select a provider, right? So when it's a good choice to consider sex therapy, it's going to be when you're experiencing low or dysfunction in any of those areas that we mentioned: desire, arousal, orgasmic. Another common sexual dysfunction that I didn't mention previously is ejaculatory inhibitants, and that's one that sometimes men suffer from as well. Not being able to ejaculate. And then the thing about these is that they don't have to be constant. So when you're having an issue with some of these areas, it doesn't mean that every single time you get the same type of result. It doesn't mean that you're not having sex at all, right? It doesn't mean that you're not having an orgasm or ejaculation at all. It means that sometimes these are issues for you, right? It could be 1 out of 3 times, 1 out of 10 times, but those particular times will put you on high alert and cause anxiousness and anxiety related to the next encounter oftentimes. So these are times when it's a good choice to think about sex therapy. When you know that medically you've gone to your medical practitioner and there is nothing that they can say that is related to the medical piece of things, the biological piece of things. And even sometimes when there are biological issues, sometimes you can actually open up those remnants of your brain that stimulate sexual sparks, right? With psychotherapy. So sex therapy can still be helpful in some of those situations, like erectile dysfunction. So you could do a combination therapeutic approach. So what are you looking for when you're selecting a provider? We talked about the connection between yourself and the provider. You also need to make sure that you pick someone who is a good fit, and that their educational platform and background aligns with a psychological foundation that, informs this particular craft or this particular discipline. Sex therapy is not one of those areas where licensing agencies or government agencies or states regulate licensing, right? Most people will certify. If you are going to see a professional, you want to make sure that the educational platform kind of meets the criteria to give you a good platform for sex therapy. You may want to look for a registered or certified sex therapist, or you may want to look for a MFT professional, because that's definitely a dedicated area of graduate studies for marriage and family therapist graduates. So those are some of the common areas you're going to find a serious amount of qualification and competence in the work that is done. Also, you might want to, ask for a free consultation that gives you an idea of what the process looks like, because going into what you can expect from a sex therapy experience, you should expect to have, a conjoint interview initially, where both partners are exploring, their perception of what the problem is and how it occurred. And then also the practitioner should be taking significant history about you guys' psychosocial influences and the constructs that inform your understanding of what sex is and how that happens. Mapping a history of potential trauma, and then you also will have an individual session that is also going to help them to map out some of the sexual trauma possibilities and some of the things that may be leading to the way that you were curated to feel about sex and intimacy, right? So these things drive the direction of the therapy, because all therapy is tailor-made for each couple, right, that comes into sex therapy or individual. Oftentimes people kind of get the marriage and family therapist piece mixed up. They don't think that we see people individually at all. We only see people as a family unit, or we see people as a couple that's married. We see premarital couples. We see couples that aren't married and aren't thinking about marriage. We see individuals. We see families. And the most important thing is to remember that we are cybernetic practitioners. So, and what that means is that we see systemic connections as to what informs how people maintain problems, right, in their lives. So that's that piece. Just want to kind of look over my notes and make sure that I am on course. Excuse me, and I am. So the purpose of sex therapy is to establish a comfortable, functional couple sex style. And that pretty much means each person is able to be incapable of experiencing all of those elements that we talked about: desire, arousal, orgasm, and an emotional connection and satisfaction. So that is the overall purpose of sex therapy. And you should expect to go through the motions, just like I listed, but also when you get to the active stages of sex therapy, you should expect a girth of homework assignments. Your sex therapist should not be engaging in sexual activity with you and your partner. It's more of a self-report type of situation. So maybe we practice some of the physical touch and arousal exercises maybe in therapy during enactment, but most of the real girth and the meat of the therapy is going to be you and your partner practicing specific exercises, and then reporting back to the therapist weekly, sometimes 2 times a week, so that we're able to monitor the progress and monitor any adjustments and treatment planning that are necessary for us to get you guys fixed up, right? Okay, so that's that piece. It always starts structured. And then as we taper off into where you guys are actually getting results, it moves to a more non-direct stance on the part of the therapist. And essentially, what I've seen in my clients is that I see them start to kind of direct what they're going to try next, because that self-discovery piece is everything. You know, they discovered one another in a way outside of no other way, right? They've increased the intimacy, and that's what we're going to talk about now, that piece of discovery and how that informs your therapeutic journey. So we talk about sexual trauma, and we talk about ways that it could be preventing you guys from being ultimately as intimate as you could possibly be. What I've noticed is taking a VSO type of approach to new experiences in sex helps people to engage in certain situations where they're completely vulnerable and may not be 100% healed from that trauma. And, you know, they can ease into new things, they can ease into trying things, and we can adapt a system where, okay, well, this is definitely not going to happen anymore. And we're okay with it because we want to make sure that our partner is 100% comfortable, because comfort is what provides the tone for intimacy and close connections. Discovery through communication is definitely important. I talk about the 3 keys of effective communication and effective conflict communication in another YouTube video. And you guys should definitely go and check that out because it's definitely worth listening to. For those of you who are familiar with some constraints of therapy, imagotherapy is closely connected to it because it does talk about speaker-listener techniques and the best way to make sure that connection is made during communication. So as we're talking to our partner, we have to be 100% receptive, and we have to take turns in learning about one another's history in sex, one another's interest in sex. So we're not listening to respond, we're listening to understand. And what that looks like is that flow of communication and that feedback loop for the communication, so that you see that your message is being delivered accurately. So what I hear you saying is such and such. Okay, so that's not what you're saying to me. So just give it to me again and see if you can correct the areas that I got wrong. Those pieces help you to learn your partner, right? And help them to be able to learn you. And it leads to a maximum level of vulnerability. You're open. You're able to receive all of them, and they are able to receive you in your entirety as well. Focus on affirmation of the desire piece. Yes, like I desire you, I want you, or reaffirmation if you've already, you know, indicated to your partner previously. Oftentimes, people do, but if you find that that's something that you talk about often, just reaffirm it. You know, I want you, I think about you, you know, and talk about those elements. And that's a part of therapy too, but we'll get into one of the exercises that I find the most helpful for couples, because essentially you guys are here for the free information. I talk about the body identification exercise. So it involves the clients being completely nude with one another for a specific amount of time without touching any element of their body, and allowing their partner to completely take over and to give them insights in front of the mirror of what they see as attractive about their mate, right? So then they're pointing out, I love this part of your body, or this is my favorite part of your body, or, you know, this is something that I find the most attractive about you. These things help to remove body shaming issues from the trauma of development, right? Essentially. And it helps people to feel more comfortable but being new. The more comfortable and more open you are to receiving your partner, and in that space, the more likely you will be able to achieve an orgasm, which is your end stage goal of sex. So if you guys have any questions for me, if you liked and enjoyed the content of this particular video, you can definitely find me by using any of the listed methods on the screen. Leave questions for me in comments or email me. Wherever you find this video, whichever social media platform you find it on, please like it, share it, subscribe to me, follow me for more great ideas about your mental and emotional health. I think it's really, really important for us to advocate for people maintaining that peace. And then just like you do with your regular biological health care, your mental, emotional, and behavioral health care should definitely be monitored on a regular basis as well. If you are not already seeing a psychotherapist or a helping professional within the field of psychology, you should definitely find yourself one. There are lots of platforms for you to be able to find one. Psychology Today is a great resource. Goodtherapy.org is also a great resource when you're searching for a therapist. It allows you to put in the demographics or geographical factors for you to be able to find somebody that is close to you, and you're able to filter your results. So that's that piece. Now we'll kind of talk about the topic of the day. And I already talked about it essentially during this presentation. So let me go here. All right. So our question comes from Joyce in Washington. Okay. And for obvious reasons, we don't release the entire name of people submitting their questions. So she writes us and she says her husband has been experiencing erectile dysfunctional type of issues. I discovered that he has low testosterone when we went to our medical doctor, and they offered medication for him. You guys have to excuse me, it's a handwritten letter, and I do struggle sometimes to read everybody's handwriting. Mine isn't the best, but so they offer medication as they offer medication as a solution to the problem. However, he's afraid to take the medication, feeling like it would only make it worse. Once he started taking the Metrogel, so this is the type of medication that he's taking. We still haven't seen any results, and if he is erect, it's only partially erect. What do we do? So we kind of talked about that already. Couples exercises can facilitate the desire concept because they build comfort with nudity, body image, and also with those struggling elements of desire concepts due to medical problems. So what I would suggest is you guys reaching out and finding a sex therapist that is a good fit for you guys, and then going over some of those possible exercises with them. There is a particular exercise that's often used for erectile dysfunction called sensate focus. And that one is particularly effective, pretty effective in situations where people have erectile dysfunction disorder. So that is pretty much what I would recommend. Also, the communication piece is big. The more you make him feel comfortable with your position, as far as what he's going through right now, the more vulnerable he will be and the more apt, to explore new things and new methods of achieving the erection he will be. So hopefully this content has been helpful for you guys. If it was, and hopefully it was, it's the month of love, right? So you got to get the sex part right. Like it and share it, subscribe to me, follow me, and help me destigmatize psychotherapy and helping services in the field of psychological sciences and all. Essentially we all need help at some point. We all will go through disparity, disappointment, adjustment, and shifts in our life. Also, mental health is extremely real and it matters. Mental health and wellness is very important. And making sure that we are balanced and functional beings, regardless of whether or not we have a mental disorder or not, and normalizing that piece, normalizing psychotherapy, normalizing helping services for mental health related problems, is definitely what we need to be moving towards, because we want to build a more functional society, right? That's the end goal, end game. That's what we aim for. So Thank you for your time. I went a little bit over 30 minutes, but that's okay. Later days, people. Thank you so much. Have a great day.